It's really important that when you're preparing for the birth of your baby and possibly planning for what your ideal birth will look like, that you should be prepared for all kinds of eventualities. Mother Nature often gets things right, and birth is a reasonably straightforward process, but even in nature, sometimes things do not go to plan. It is hard to be prepared for every single potential situation or scenario that might occur in labour and birth, because each person's labour and birth experience is absolutely unique. But to have a general idea of what these situations can mean to the type of care you were given and where you'll be receiving that care will be really helpful in making you feel nicely prepared. The job of midwives is to support you and to provide you with that care, whilst they are also making sure that everything that is happening is staying within what would be considered straightforward and physiological. If anything happens in your labour experience that suggests things might not be quite so straightforward, it may well be that you're offered various different interventions. If you are planning a home birth, this might mean that the midwives caring for you suggest that they feel the time is right to phone an ambulance and get you moved to hospital. If this happens, you will be strongly recommended to follow the advice to move, but you should have the reasons explained to you, which will help to support you in your informed decision making. There can be a multitude of reasons that might suggest this, such as if the baby is showing signs of distress, or if there's any bleeding or any other emergency complications that are arising. For this reason, it is so sensible that you plan what would happen if it's suggested that you make that move into hospital. For example, by having that hospital bag ready that you can take in with you that will hopefully make that experience calmer for you. Your hospital bag can include things that will help to make things feel better, for example, some pretty sparkly lights maybe, aromatherapy, or just any objects that make you feel comfortable and safe. You can still use your calming techniques you might be using at home, such as your breathing techniques or your aromatherapy that you are planning to use. You may have planned your birth in a midwife-led unit, which offers lower levels of intervention, but again, as with the home birth, if the midwife's assessment of that things are not quite so straightforward, they may recommend a transfer to the doctor obstetric-led unit. Again, you should have the information about their assessment that enables you to make a fully informed decision, and a plan should be in place for if this does happen. Other times you might be moved, or as if you're having a water birth and you're planning to labour in a water-based environment, but any complication arises that suggests that you should be getting out of the pool and perhaps into a room with more emergency equipment and a bed available if it's needed. Another change during complications might include a move to theatre. It can be really helpful in your pregnancy if the midwife talks you through what your local obstetric theatre is like and what will happen in there, so you can feel more prepared should you ever be need to be moved into theatre for any reason. For any of the above scenarios, you can talk through what adjustments you would need to be made to make these situations easier for you to manage, and this can be part of your birth planning documents.